Bismillahirrahmanirrahim. Good morning, everyone. I'm lecturer Mr. Mehdi. I am start with case sheet and the clinical examination for the patient attending the prosthodontic department and attending the prosthodontic clinic in summer training session. The case sheet and the clinical examination represent the primary steps in complete denture construction. For the patient, to start with the name of the patient and end with the follow-up steps for the complete denture edentulous patient. Before you start with the case sheet and the clinical examination of the patient, you have to take your precautions regarding the special infection control, especially in this period of time as we have epidemic transmission of COVID-19 virus. You have to wear a lab coat, a gown, face shield, head cover, qualified mask, and goggles and gloves. And all of you have to carry alcohol-based antiseptic to sterile your hand and sterile the chair equipment. Also, all of the diagnostic instruments have to be sterile and disposable. You are dealing with the oral cavity, so you have to take your good precautions. The case should start with taking the social information from the patient, start with the work of the patient, marital status of the patient, socio-economical level of the patient, whether the patient have a work or is retired, stay at home, and all the information regarding the social activity of the patient. All this information will have benefits for you regarding the special deal with the patient. The psychological behavior of the patient is very important. The psychological information have to be taken in consideration and include the patient's attitude to the denture and his expectation from the treatment of the denture. The systemic health of the patient is also important. It have to be taken carefully as many systemic diseases have oral manifestation like diabetic, diabetes and heart problem. Many of the systemic disorder affect the oral mucosa and the oral health and the saliva of the patient. Some drugs induce xerostomia, some induce excessive salivation. All these affect the proper denture construction for completely edentulous patient. Also, systemic disease have to be taken in consideration carefully, especially to patients that require pre-prosthetic surgery management. Dentist-specific observation start with extraoral evaluation, start with overlook for the patient face, start with observation of the facial symmetry, lip competence, facial length, face fullness. Also, you have to examine the temporomandibular joint to observe the presence of crepitation and the clicking if present and pain if exists. Intraoral examination starts with checking of the mucosa of the patient, whether it's firmly attached to the underlying bone or loosely attached, and this especially affects the proper impression and impression material used for taking the final impression. The tongue size is also important. You can check it by looking for the lateral border of the tongue, whether it's attached or touched to the lateral side of the alveolar ridge, or it's covered the whole alveolar ridge, and that affect the fullness of the denture inside the patient mouth. Saliva, salivary flow, whether it's mucus or serous. Also, we have to look for the over secretion, drooling of saliva, or a case of dry mouth if exists. The ridge morphology is a very important factor to be noticed because it affects the quality of the ridge. Sorry, the quality of the complete denture. The tori, the undercut, a large tuberosity also affect the better stability and extension of the denture base. It has to be checked if it interferes with the proper path of insertion and removal of the denture, all, or if it is cause excessive trauma during insertion and removal of the complete denture. The teeth, if it is present inside the patient mouth, have to be taken into consideration. If it is beneficial for the complete denture, if it affects the proper seal, if it can be beneficial for the add more retention for the denture, the teeth have to be checked for its periodontal health. Bucket if present, mobility, also the caries if present, the teeth if it is restorable or not. Also, one from the most important factor to be checked if it's the presence of old denture. The old denture have to be checked for its stability, retention, and support. It have to be checked for the facial support, for the lip and cheek support, for its aesthetic and phonetic properties. Also, the occlusal relation of the old denture. We can take radiographic imaging for the complete denture patient, like OBG, to verify the bone and the supporting structure and the parallelism of the alveolar ridge. Study cast can be taken for the patient by taking primary impression or simple alginate impression to verify the alveolar ridge and the relation of the occlusal scheme of the patient carefully to get better choice for the treatment option for the patient. This is the case sheet of the patient. Start with the student name and the group of the student, the patient name, the age of the patient, the gender of the patient, and the occupation of the patient. Also, the address and the phone number have to be checked with the patient, especially the phone number, to have better communication with the patient regarding the date of the visits. You start with the medical history, rheumatic fever, arthritis, jaundice, anemia, epilepsy. It's important to be checked. Heart disease, bleeding disorder, asthma, diabetes, kidney problem, and other present. You have to specify and have a brief record for the medication take for the patient. Some patients cannot tell you the true systemic disease, and you can ask indirect question about the drugs and correlate the drugs with the specific systemic disease. The dental history starts with the chief complaint of the patient, and this is recorded and summarized here on the patient own words, whether he came because of he have pain, or for the aesthetic, or for the function problem, or for all of these or some of these reasons. The date of last visit for the dentist, reason of the visits. This is important to know. The cause of visit to the dentist, and if the patient have a regular visit or not. The reasons for the loss of the teeth, whether for a periodontal disease, caries, and other causes like trauma or injury. The patient experience with the previous removable denture, or the type of the denture, whether it's have a good experience or have a bad experience, and the problem with the old denture. It's summarized here for the attention problem, whether it's good, bad, stability problem, and for the aesthetic problem. The vertical jaw relation, whether it decreased or increased. The horizontal jaw relation, whether it's good or bad occlusion. Sorry, and the for occlusion, if it is good or bad. The mean of good or bad for the occlusion mean it have a good occlusal scheme, have a good chewing abilities, and have a good cutting efficiency. If the patient say that he cannot eat or he cannot chew or he cannot cut any type of food with all denture, that means it's have a bad occlusion scheme. For the extraoral examination, start with the frontal facial appearance, whether it's have a square face, tapered, or a wide face, facial profile, whether it's straight, concave, or convex, from the profile of the patient, the TM joint, as we said before, mouth opening and closing, whether the patient have limitation, deviation, or clicking and crepitation and pain. The masticatory muscle tone, especially the masseter and temporalis muscle, whether it's normal or tense, and its effect on the alveolar ridge. The lip form of the patient, whether have long lip, short lip, average, between long and short. The lip thickness, whether it's thick and thin, and that's affect the denture support for the lip. The lip curvature, whether it's curved upward, curved downward, and other extra oral features it presents we can add at the end of that. The intraoral examination starts with the arch form for the maxilla, U shape, V shape, square, for the mandible the same, for the arch size, for the maxilla, large, small, average, for the mandible, also for the ridge form as we said before. This is important factor whether it's have normal, flat, or irregular surface for the ridge. The mucosa is very important whether it's firm or flabby attached. Also for the mandible, this is you can see in the upper and lower anterior area of the patient have ill-fit old denture. Also for the anterior posterior regulation, we can see from the profile of the patient whether it's have class 1, class 2, or class 3. The tongue size, large, small, average, the position of the tongue, what's normal, retruded or protruded, and the palatal form, whether it's U shape, V shape, or flat. This is another view for the case sheet of the patient. This is the case sheet that represents the steps of complete dental construction with its details. Start with the student name, patient name, diagnosis and treatment plan, the supervisor name, supervisor signature, date of visits. Start with the steps, primary impression for the upper and the lower, primary cast, special tray, final impression, final cast boring, record base, jaw relation registration, teeth arrangement, tray in stage, waxing for the laboratory step, body for flasking for the laboratory step, and denture insertion and its degree, and the post insertion recalls and notes. This represents a maxillary edentulous arch with the presence of maxillary tuberosity with U-shaped ridge and irregular ridge form. This is how you examine the presence of flap tissue. You can see here we use a blunt instrument like the handle of mirror to examine the flabby tissue and record the area of flabby tissue. This represents the oral picture of the presence of all denture, and you can see that the presence of erythema and redness of the alveolar ridge. This indicates some sort of ill-fitting denture and presence of infection like candidal infection or that cause irritation for the surface of the mucosa underneath the old denture. This represents the presence of all lower complete denture with the presence of flabby tissue from the chronic irritation of overextended border of the denture that cause this flabby tissue. This picture represents how to examine the mucosa of the lower complete denture for evaluation of the mucosa and the presence of loosely attached or firm attached mucosa. In the next step or the next video, we will start to have a live demonstration for taking primary and final impression for complete denture patient. Thank you very much for your listening.